Hello everybody and welcome to the Thursday edition of Video Clips. And this is an area that we really need to spend some time on today. It's these new blood pressure guidelines. So I even have a graphic for you here, make it easier for you to understand some of the things I'm going to tell you. But according to new guidelines developed by the American Heart Association and the American College of Cardiology, the number of men under age 45 who now qualify for a diagnosis of high blood pressure has tripled, and the number of women who now qualify for a diagnosis is doubled. Now I want to translate this into numbers that will be a little bit more meaningful for you. The number of adults who have hypertension increased from 72 million to 103 million with the stroke of a pen, and the number and the doses of drugs needed to treat this new target increased too. Almost half of American adults and 80% of adults over age 65 now qualify for diagnosis and treatment for hypertension. The new guidelines stipulate that high blood pressure is now defined as 130 over 80. The previous guidelines were 140 over 90. To be considered normal, I've put air quotes around that, adults must now have systolic pressure under 120 and diastolic pressure under 80. A person who has a systolic reading of 120 to 129 and diastolic pressure of under 80 is now classified as having high blood pressure. This affects 12% of all adults. Now, I won't go into this right now. There's an article in the Health Briefs Library. I've written a lot about this issue of medicating people with low diastolic pressure, which has a lot of risk associated with it. So we're going to do more of that now, according to these new guidelines. For drug companies that make medications to treat hypertension, this is like winning the lottery. For patients, this will mean more overdiagnosis, more overtreatment, and more harm. While the expert committee, I would put air quotes around that, reviewed over 1,000 papers, the SPRINT trial was cited as the most convincing for lowering the threshold. The SPRINT study I've written quite a bit about, and one of the reasons is because I think this is one of the more disturbing studies that I've covered in all of the years I've been doing this kind of thing in terms of the hype about it versus what really is the deal. So I'll tell you a little bit about SPRINT, because this is what influenced the committee the most. They actually said this in their findings. The SPRINT study followed 9,361 hypertension patients age 50 and older who were randomized into two groups. The goal for one group was to lower systolic pressure to below 140. The other group was to get it to 120. Those in the lower target group were given an average of 2.8 pills a day. Many of them taking, that's an average, some of them were taking as many as 4 or 5 different drugs in order to get that blood pressure down. Now, if you read the articles describing the study versus the results, you can hardly believe everybody's talking about the same thing. So it was described in the newspapers and doctors being interviewed on Medscape and this sort of thing as a landmark study that would change cardiology. The researchers reported that patients in the lower target group were so much better off that the study had to be halted early because it was just unethical to withhold the aggressive treatment from the patients who were in the control group. So let's see what all the excitement was all about. So I prepared a little graphic for you here so that you can follow this, because it's hard when I just read a bunch of numbers for you guys to follow along. So we had a control group and an intervention group. The intervention group, we're going to give them as many drugs as we need to get their blood pressure down. So what happened? Well, in the control group, deaths, we had 210 in the control group and 155 in the intervention group. Well, that seems kind of impressive, but if you look at the incidence, you can see it's very small in both groups, but the reduction was 0.0117%. Not even 1%. Okay? Now, heart failure, we had 100 in the control group, we had 62 in the intervention group. Again, if you look at the incidence, so yes, there's a reduction, but your actual reduction in incidence is 0.0081%. Are you just blown away? Landmark study? I mean, in what universe is this landmark? Then we've got heart attack, heart failure, stroke, death from heart disease. We've got 319 events in the control group, 243 in the intervention group. We've got a reduction of a little over 0.5%. Landmark? Okay. All right. So let me just kind of summarize what this means. All right. So we had the bottom line is there was a slightly greater than 1% reduction in deaths, slightly less than 1% lower incidence of heart failure, about 1/2 of 1% decrease in events overall. Now, in return for these underwhelming results, 5% of the intervention patients had serious complications, which included blood pressure so low it caused severe dizziness or fainting, electrolyte imbalances, and kidney damage. The incidence of serious complications in the control group was roughly half of that. In spite of this, the principal investigator stated, quote, "It seems that the benefits outweigh the risks." Again, it doesn't seem like we're talking about the same study, but I guess we are. Now back to the new blood pressure guidelines. So Gilbert Welch, medical doctor, who's one of my favorite guys, he's written some great books on overdiagnosis and overtreatment. He voiced similar concerns to mine about the new guidelines in a new New York Times op-ed piece. He states that the results of the SPRINT trial were so small and insignificant that the New England Journal of Medicine, which first reported the results, had to use special graphics which are reserved for situations in which the results of a study or an outcome are so tiny that they barely register on a graph. Okay. He also states that participants in the SPRINT trial had a higher than average risk for cardiovascular events, which means that the everyday person is going to benefit even less. I mean, with this tiny, tiny amount where we needed special graphics to even get it to show up in a graphic presentation, the general public is going to benefit even less. The bigger issue, Welch says, and I agree with him, has to do with the way in which blood pressure is measured. In this SPRINT trial, blood pressure was taken 3 times during each office visit, including after a few minutes of quiet rest with no staff in the room. This is not the way blood pressure is measured in a typical visit to a doctor's office. You probably have experienced this firsthand. And, you know, we all have heard of white coat syndrome. Many patients have higher blood pressure in the doctor's office to begin with. So the likelihood increases that there will be even more diagnosis and more overtreatment. Now, the new guidelines instruct doctors to measure blood pressure 2 or more times on 2 or more occasions in order to make a determination, but this is just not the way today's medicine works, so we can look forward to a lot of harm. Welch is concerned that while many doctors will try to ignore the new guidelines, there may be considerable coercion applied once the healthcare industry establishes hitting the new low target as a measurement of physician performance. And you better bet, I believe, that the drug companies are going to be all over making sure that that happens. This will cause doctors to do whatever is necessary to lower blood pressure even more, which will mean more medication and more side effects. In fact, a recent study showed that this is likely to be the case. The authors of this review report that 53.4% of patients who are currently medicated for hypertension have not achieved the target according to the new guidelines and will require either more of the medication they're taking or more different medications to be added to their regime. Many other experts are weighing in who are concerned about the recommendations too. Kenneth Lynn, Associate Professor of Family Medicine at Georgetown University School of Medicine, worries that just as lowering the threshold for blood glucose resulted in more people being unnecessarily medicated, the same thing will happen with blood pressure. He states that a major omission from the guidelines is the discussion of harms related to more aggressive treatment, and that a shared decision-making tool to facilitate discussions between doctors and patients would have been helpful. Well, if you watched Tuesday's edition of Video Clips, that's what it was all about. There's just not much informed decision-making going on in doctors' offices. Brian Williams, Chair of Medicine at University College London, is concerned about the worried well who will now become unnecessarily concerned about their systolic pressure at 130. Several experts are concerned that the target for everybody is now the same with no consideration of risk. J. Michael Gaziano states that while studies show that lowering blood pressure more reduces cardiovascular events, they haven't really shown that there's a magic number that works for everybody. Citing examples of patients who have experienced better health but not yet met the lower target, he expressed concern that he will be judged based on his patients hitting the target, not their improved health status. Frank Messerly, medical doctor, says that, quote, patients are genetically, physiologically, metabolically, pathologically, and psychologically and socially different. Therefore, attempts to lower blood pressure for everyone to one target is, quote, considered absurd. He expressed hope that doctors will try to treat patients instead of just blood pressure readings. And several doctors expressed particular concern about the elderly who are already at higher risk of falls and renal failure, and more medication can increase this risk. Dr. Messerly says an 85-year-old is not the same as a 25-year-old. Like others, Messerly is also concerned about the worried well, and he has an interesting perspective on this. I'll read you his quote here. He says the act of labeling someone as hypertensive not only triggers absenteeism, neuroticism, anxiety, perception of poor health, deterioration of marital and home life, and symptoms of depression, but it also may cause a subsequent increase in blood pressure, most probably mediated by increased sympathetic activity. Thus, becoming aware that one has hypertension may beget more hypertension. And there's a lot been written about this, by the way, that labeling somebody with a disease, the very act of saying to somebody, you are sick, actually begins a psychological deterioration that leads to more physical deterioration. The American Academy of Family Physicians announced that it will not endorse the new guidelines for different reasons: methodology and conflicts of interest. The group intends to adhere to the 2014 guidelines, which state that for people 60 and older, treatment should start at 150/90, and for those younger than 60 at 140/90. The reason why this group is rejecting the guidelines is due to the fact that they were not based on a systematic evidence review. The group says too much weight was given to the SPRINT trial and not enough to other trials, which is one of my major concerns, as I stated earlier. The committee chair was the principal investigator for the SPRINT trial. Isn't that cozy? And several other panel members also had intellectual conflicts of interest. Now we get to the really frustrating part, in case you're not already frustrated. The New York Times, in conjunction with this, featured an article about how to lower blood pressure, and its guidelines are so terrible that following them will result in even more people being medicated. Well, it starts out while rightly stating that alcohol increases blood pressure. The author, Gina Colada, advises men to limit their intake to 2 drinks a day, and for women it should be only 1 drink per day. This is a ridiculous amount of alcohol that can not only increase the risk of hypertension and all kinds of other cardiovascular issues, but also has a significant contribution to increasing the risk of cancer. Colada also states that medications and supplements like amphetamines, decongestants, St. John's wort, NSAIDs, and steroids raise blood pressure, but she doesn't instruct patients to tell their doctors if they're diagnosed with hypertension, hey, I'm taking these drugs. You think doctors would pick up on this. They don't. I've talked to people here all the time who have hypertension and are not aware that it's being caused by drugs that they're taking. Nor does she, of course, mention that most of the conditions for which these drugs are used can be resolved with diet and lifestyle change, and the medications can therefore be eliminated. She advises that weight loss can help people to avoid medications, as can diet, but she goes on to say the DASH diet, which was shown to be successful in reducing blood pressure by as much as 11 points as a result of eating fruits, vegetables, and whole grains, it's just too hard to follow without the help of a dietitian. I just find that ludicrous on its face. I mean, I talk to people every day who've watched documentaries on Netflix and changed their diet on their own and adopted a much stricter diet than DASH. Then she says, exercise works, but the benefit disappears if people stop. Wow. It makes you want to subscribe to the New York Times. Yeah, my cameraman laughed at that. Yeah, I'll tell you what, they always really have like the latest and greatest stuff, which just blows your mind, right? Well, then she has a sub-headline in the article that says, I hate dieting and exercise, what about the drugs? Now this has dropped, my jaw dropped. Colada states that most patients tolerate the drugs well. Well, all you people who have friends on hypertension medications, or if you've taken blood pressure medications yourself, you know that's patently false. All drugs have side effects, and there are more side effects associated with taking more drugs and higher doses. And many people will inevitably be doing both of those things as a result of these new guidelines. Well, there's just nothing like a major newspaper featuring a big article with inaccurate and misleading information to make the mess even bigger. But Colada's article is representative of the current thinking of much of the medical community. So I mentioned this Dr. Messerly, who is one of the docs that was most concerned about the implications of the new guidelines. So this is what he has to say about diet and lifestyle change. He says, quote, among the 11% of U.S. adults who now meet the definition of hypertension as per ACC/AHA guidelines, but in whom drug therapy is not advised, most, if not all, will never reach the target less than 130/80, and any attempt to postpone antihypertensive therapy will slowly but relentlessly give rise to target organ disease. He added, I think lifestyle advice is just too difficult to implement. I've practiced for many years and treated thousands of patients, and I treat first with a pill. This is what he says. I tell my patients, if you lose weight, exercise, reduce salt intake, etc., you can stop the medication. But I've yet to see a patient where this has happened in thousands of patients. Patients just don't do it. He went on to say that recommending diet and lifestyle first and waiting for the inevitable rise in blood pressure is a waste of time. Diet and lifestyle advice should not be given, he says, at the cost of withholding medication. Gosh, what a great guy. Well, the fact that Messerly has never seen a patient improve his health with diet reflects more on his lack of knowledge about nutrition and health and his inability to inspire patients to want to change their diets and show them how to do it. It's not entirely his fault. I do always have to add the caveat because I am hard on doctors. They don't get any training about nutrition in medical school. But Messerly is very representative of the attitude of the medical community that the problem is patients just don't care about themselves, they're not willing to work hard and all that sort of thing. I mean, I am positive Messerly is not spending any time going through the science of plant-based nutrition and that sort of thing and talking with his patients. This entire debacle is unfortunate, but very predictable. What's important for I think it's important for experts to meet and review data and develop treatment guidelines. The process is consistently plagued with conflicts of interest. And then you add to this the tendency to exaggerate benefits, minimize risks, and make one-size-fits-all recommendation, and medicine just gets worse instead of better every year. Most health professionals don't know much about the causes of the diseases they're treating, most of which are what we call foodborne illnesses. Nutritional guidelines given by the government are generally wrong. Media coverage adds to the mess by relating the advice of experts, which are not very well vetted. So public health continues to get worse instead of better. So here's my advice about all of this. You can't really give anybody specific advice in a format like this, but it is highly likely that people who are interacting with doctors are going to be told that their blood pressure is high at lower and lower thresholds, and people who are already medicated for blood pressure are going to be told to take more meds. I think that it's very important to figure out if the benefits of medication are really enough to warrant taking the drugs and the risks associated with it. So have that informed discussion. If your doctor doesn't know how to have it, hire us to have access to our libraries and our information, or talk to somebody who can review this with you carefully. The idea that 30-some million more people are going to qualify for drugs is frightening. And our healthcare bill and the ineptitude, it's so ginormous right now, you think it can't get worse? Mark my words, it's going to get worse. All right, that's all for today. As usual, pass this on to anybody who you think would enjoy watching it, and I'll be back to you next week with more news.